Good evening. Thanks for staying up with us tonight. Doctors at ICUs across the state are again raising the red flag about another surge in COVID cases flooding hospitals. So for our big story tonight, we are looking into the emergency plan some are considering if things don't improve. We break down how this year's COVID cases compare to the spike we saw last year, and we'll be sharing the new plan from President Biden to keep the Omicron variant from worsening the winter surge.
Doctors call it a pandemic among the unvaccinated. And as we head into the winter months, some fear that could cause the worst surge yet.
I'm worried about the way the winter's going to go, and I'm worried about the people who are unvaccinated.
Dr. Gabriel Boslett at IU Health tweeted out this warning to Hoosiers, saying if you have not been vaccinated, now is the time.
If people would just get vaccinated, 95% of the people that I meet in the intensive care unit, I would never meet, and things would be normal. And so it's hard because I don't know what else to do to make people understand.
Since August, hospitals have been in surge mode with cases climbing. At that time, IU Health had 107 patients with COVID. On Tuesday, they had 328. And we know COVID thrives in cold weather, especially around the holidays when people are gathering. But this year, health officials are worried about three things: a more contagious variant, and also healthcare workers short-staffed and tired.
We are exhausted, emotionally exhausted. It's really hard to see this many people die.
And for many, it feels like deja vu. Around this time last year, Indiana reached its peak with more than 3,400 Hoosiers hospitalized. This year, the number is lower, but some worry it's just the start.
And what makes it even more difficult is that we just have a lot more patients in our hospital. We have more patients in our hospital today than we ever had.
And the thing is, it's not all COVID patients, but the concern is beds are filling up at an alarming rate, causing hospitals like Community Health Network to start preparing.
Our staff and our leadership I've instructed them this week to look at contingency plans. If every one in every 3 or 1 every 4 beds is a COVID patient, what do we do?
One option is to delay surgeries and other services, affecting even more Hoosiers in need of care.
Get the vaccination, not for yourself, but for your family member and for your neighbor, because one of you may have a health condition that needs a hospital bed, and there may not be one.
Another reason to roll up your sleeve sooner than later.
Right now, about 51% of Hoosiers are fully vaccinated, which isn't really that great compared to the rest of the country. Take a look here. We ranked 40th. Only these 10 states in gray are worse than we are. And when it comes to the booster shot, still not looking great. 22% of Hoosiers have their booster, which puts us 30th in the nation. Only 20 other states have worse rates than we do with the booster shot. Now, today, President Biden announced vaccinations as a key part of his plan to prevent another winter surge, especially as the Omicron variant starts spreading across the country.
We're going to fight this variant with science and speed, not chaos and confusion.
Several new cases of the variant were reported today in Minnesota, Colorado, and New York. So far, there are no confirmed cases here in Indiana, but doctors say it's really just a matter of time since the Omicron variant is highly transmissible. That's why the president laid out a 5-step plan today to try and contain the spread. So let's break it down here. Like we mentioned, the first few steps are all about vaccinations. Up first, increasing booster shots. Turns out 100 million Americans are eligible but haven't gotten theirs yet. Up next, increasing vaccinations among kids as young as 5, and then it's all about COVID testing and treatment. The White House wants to distribute COVID treatment pills like Merck's around the country as soon as they're approved, and expand free at-home testing for those who struggle to afford it. The White House is also extending transportation mask mandates through March. So any public transportation like planes, buses, or trains will continue to require masks. And lastly, travel COVID testing. If you're flying into the country from overseas, you'll have to test negative within 24 hours of your flight. We know this is a whole lot to unpack here, so head to our website, WTHR.com, for answers to your questions. And that wraps up tonight's big story.